A presentation on the COVID-19 presented by the MBBS Phase 1 students GMC Kathua.
First of all, a grand salute to the workforce of Government Medical College Kathua and associated hospitals and every healthcare worker who has been on the front line to fight this pandemic. COVID-19 is an infectious disease caused by severe acute respiratory syndrome, coronavirus 2. It was first detected in Wuhan, China, and reported to the World Health Organization country office in China on 31st December 2019. The symptoms commonly include fever, dry cough, and breathing difficulty. Some patients also have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. The virus is mainly spread through droplets produced upon coughing or sneezing of an infected person. The COVID-19 has since its outbreak spread across more than 200 countries and territories, thus becoming a pandemic. As of 4 April 2020, more than 11,30,000 cases have been reported all over the world, resulting in over 60,100 deaths. More than 2,33,000 people have recovered. As of 6 April 2020, India has 3,666 active cases. 291 patients have been cured or discharged. 109 people have lost their lives to this disease. The Union Territory of Jammu and Kashmir stands at number 11th in the total number of coronavirus cases in the country. We have 109 confirmed cases, 103 active cases and 6 closed cases, which include 4 cured and 2 deceased patients. The role of frontline workers in this pandemic is twofold. It is to spread key messages in the community about the measures to prevent the infection, as well as to take actions for the early detection and referral of the suspected COVID-19 cases.
But a lot of frustrations await you. You have chosen to put yourselves on the front lines of the most important battleground today, a battle we can't afford to lose. You risk your own health and endure burnout and exhaustion, among many other challenges. Your professional life happens to take a toll on your personal affairs. Some health workers putting up in rented accommodations are being wrongly abandoned by their societies. At workplace, the supplies are limited. Some may even be working without proper personal protection equipment. There may be shortage of workforce and inpatient accommodation, besides other facilities like ICUs crucial for patient care. All of us are not born with patience, and perseverance does not come into play until we meet circumstances in which it's possible to give up. As health professionals, it's you and you alone who have the privilege and obligation to probe the hearts, minds, and souls of the fellow citizens we sometimes call patients. But we want you and your family to be safe as well. Self-care is essential. Take all preventive measures that we are talking about in the community, such as keeping safe distance, washing hands frequently, including before and after home visits. Self-monitor for the signs of illness and report to the medical officer immediately if any symptoms develop.
Being your students, we take great pride in having you all as our guardian angels. COVID-19 will not be the last dangerous microbe we see. The heroism, dedication, and selflessness of medical staff allow the rest of us a degree of reassurance that we will overcome this virus. To all the healthcare workers out there, doctors, nurses, technicians, medical staff, administrators, food service workers, pharmacists, security guards, and our military deployed to set up hospitals and deliver aid, our nation owes you our thanks.